Good morning and welcome to Martin County BOCC press conference concerning the recent events in Martin County. Officials met this morning about the fact that we are considered in a hepatitis A outbreak in Martin County. What that entails is there's actually 13 confirmed cases of hepatitis A in Martin County since January of 2019. The State Department of Health considers the community at high risk when there is a confirmed number of cases greater than 5. Today, we met as community leaders, public safety partners, to meet and speak about this and discuss it with our state partners via conference call. With me today from my right, Commissioner Ed Campy, Sheriff Snyder, Todd Reinhold from Department of Health, Florida Department of Health, Martin County, and County Administrator Taryn Krizda. I am Bill Schobel, Martin County Fire Rescue Fire Chief. We're working together to address the issue. What I want to let you know as a community, things are under control. This is not a unusual thing to occur throughout even our nation, but the state has identified approximately half the counties of having an outbreak. Again, that's the trigger point is 5 or more cases within the county. If you're wondering exactly what to do, how can I prevent this? We want to direct you to proper resources, and Florida Department of Health's website is the best. It's a comprehensive view of what hepatitis A is, how you contract it, how you can prevent from contracting it, and what to do if you think you might have the symptoms. I empathize with anyone in the community, with children as well. If you're worried, contact your pediatrician. Your child should have been vaccinated for Hep A in their younger years, and if not, if you have any concerns, you can ask your pediatrician to draw a titer, and they can assure you that the antibodies are in your child's blood. But really, good hygiene, hand washing, hand washing, hand washing. That is the key to this. Just good common sense hygiene helps prevent the spread of this disease. The major concern, the other aspects of course, what are we doing? We are going to have a comprehensive sheet to provide with early afternoon hours, and we'll put that out on all the websites, on the Martin County BOCC website, on the Martin County Sheriff's Office website, Florida Department of Health, every website we can. We want to make sure that we're communicating effectively to the community and answering any questions. And social media as well. So with that, I'd like to take your questions. Other aspects provide what do we do early afternoon hours. We're going to have we'll put that out on all the websites. Megan, that's a great question. The question is, what's being done to track exactly where potentially the source is? What happens, the system in place within our state is if a patient comes to a fixed facility, it could be a doctor's office to an emergency room, and they present with certain symptomology, what will happen is they'll be tested. Once the tests are confirmed that they do have hepatitis A, a contagious disease, they're required to report that to the state. The state then communicates with the local Florida Department of Health on a county level, and they can look into potential sources. One potential source could always they have looked at this. There is no effective source we can isolate here in Martin County. Awesome. Timeline of when the cases started to pop up. There's actually 1,200 cases statewide. Within Martin County, the cases started to pop up since January of this year, and there is a total of 13 cases right now in Martin County. Timeline of when the cases started to pop up. There's actually 1,200 cases. There was 5 cases, April 1st, and so since then there have been 8 more cases, to total 13. There's actually 1,200 cases. There was 5 cases, April 1st, and so since then there have been 8 more cases. Question is do we have any trend or a location in Martin County that we can isolate potentially a city? Can you help me with that?
Yeah, at this point, no.
All right.
this, I can't
And so since
provide individual information, but at this
the
point, we
question
aren't
is
seeing.
do we have any trend or location in Martin County that we can isolate potentially a city? Not at this time, no. And again, anybody that contracts this, they are questioned because, of course, we want to isolate as quickly as possible. But that's only one source or one type of spread that it could occur in Martin County. It's a common type. Of course, if you look around historically around the state, and again, it says this on the website. It talks about shellfish. It talks about any uncooked food or like a salad bar type area and so forth. And unfortunately, it's an oral fecal transmission, so it would have to be someone who didn't provide good hygiene and then handled your unprepared food, and then you ate it.
Yes. Yes. Our office, the health department, has communicated with the Department of Business and Professional Regulation, the Florida Department of Agriculture. They are doing their due diligence and, informing those areas where, there's restaurants, and to inform them of just basic hygiene. It's something that these restaurants and groceries go through on a daily basis. Hygiene, hand washing and making sure that they're implementing their policies, their sick leave policies, and that we try to, prevent any spread of a disease. Do I have a number on that, Renee?
8.
Yeah, 8 cases out of 1,200. I think since 2018. I'm not sure. I can't speak to specific cases with the Department of Health because of HIPAA violations. Well, hepatitis A is a commonly spread virus that moves through communities, just like other illnesses that we see come up, through communities. And depending on how we, take care of ourselves and hygiene, we can prevent these diseases from spreading. That's typically the best way to deal with it, and that's what we're encouraging repeatedly over and over again is hand washing, extensive hand washing, and be aware of that. Yeah, and of course vaccination. Of the high risk population. Could you repeat that? We could probably collect that information for you. I know we have the statistics. Our epidemiology departments are the ones that track these illnesses and investigations, so we have those statistics. I may need to get that for you. I think anyone that you feel you are experiencing illness and you need, you feel like there's a concern for any associated symptoms, you should see your primary care physician. That's just a normal day, blue sky condition, so that shouldn't change for this. Again, I think I've already answered that question when Megan asked it. If it's regard to like specific cases, I can't answer those questions. Monday. It was that recent, yes. Confirmed cases. When I say that, I mean by scientific data, we have the lab report in hand, and we can confirm that. We may be working through our labs and be getting verbals on certain things, but they have to run multiple assays. So sometimes we may sort of have an idea of a case, but until it's confirmed, something could change. So yes. Well, as far as the Department of Health's plan from high risk, once we hit 5 cases on Monday, we're addressing that high risk population, which includes working with the sheriff and his jail, which is, to try and vaccinate that population, which is high risk, perhaps even homeless population, working with the sheriff. I think he may have an idea of where we can target some of these outreach efforts, but mainly public. Again, I'm not sure if I answered that one. I think Yeah, I think that, well, to answer your question about notification, the health department, the state health department provided information to the public, I believe back in December, about cases and how to protect yourself for this particular virus. You all, I believe, shared that information. It's the same scenario, getting that information out to the community. That was a high risk scenario. So again, we don't want to like Chief Schobel said, this is not uncommon for a virus like this to come into a community. How we protect against it, but yes, certainly, if there's certain cases that may bring high attention to something, that's the result of what we're dealing with now, of course. But yeah, we will communicate what we can communicate. But again, when you're dealing with HIPAA and privacy laws, there's certain things we can't report. Yes, we have had 5 cases on Monday, and we became a high risk community at that point, where we have a plan. We've had a plan before that on how to address that. We're working that plan through our partners is primarily, and that's what we're here today.
Go ahead. Megan, they're asking about notification, and what I really want to emphasize right now is moving forward, this notification, consider this, and please communicate with our community. Have a plan. If you do come down with these symptoms, seek medical attention immediately and follow that care provider's advice. The other thing is, if you're worried about a vaccination, again, contact your care provider, and they might provide it for you. And again, we don't want to provide an over run of the physician offices today. There is, in the coming days, there will be more. Now, the information that's going to be provided later on this afternoon will tell you when to contact, because obviously, if we have 1,000 people that need the vaccine immediately, we might not have that number of vaccines available today. So look to your family, get a plan. If you're concerned about your children, reach out to your pediatrician, get the titers checked, and make sure that your child has the antibody in their blood. And then yourself as well, you can get the vaccine. You don't have to be tested for hepatitis A to get the vaccine. Our state partners conveyed that to us today. You can reach out, get the vaccine. It's easy. So we really want to, moving forward, we want to make sure that everybody has a plan and be able to react appropriately.
Well, I wanted to go back to Megan's question, because once we were confirmed with the cases here in Martin County, the health department reached out to us. The sheriff, once he realized the confirmation of the individuals in Palm City, reached out to us, and that's why we had our meeting this morning, so that we could bring those individuals together to make sure that we're getting the information and that we're now communicating it to the public. Your question was relative to children? Well, what we got this morning from the health department is, if you have a concern, you can get vaccinated. You don't have to wait until you get the symptoms to get vaccinated. If you have a concern with your children, if they're being exposed to other children that are possibly sick, then they can go and they can get vaccinated. But again, go to your health provider and see what your health provider would recommend. If the health provider feels that you have other complications or other physical indications that you should be vaccinated, that's who I would rely on for that information.
It's a personal choice. If you believe in vaccinations, then I would recommend that you seek out your healthcare provider and ask what they would recommend. It's one vaccination, but all right. Right. The question is the vaccination, what exactly is it, 1 shot or 2? And it's 2 shots. It's 6 months apart. And then again, Renee, help me out here, because we can be tested. As a healthcare provider, I was vaccinated from hepatitis B many years ago. My titer is drawn every year to assure that I still have the antibodies in my system. Is that consistent with hepatitis A as well? Any other questions? Renee? Yeah.
The question is, what is the sheriff's office role in this? The answer is very simple, is that I have more investigators available than any other agency that would be investigating this. So we have volunteered our detective services to the State Department. If they begin wanting to check possible sources, we'll be glad to go out and do some of the checking for them. The other thing we do is we will be able to use our social media platform and put the message out. We are now thankful to have this information. I've had first responders going into cases that had they known there was a hepatitis hotspot here, they may have taken additional precautions. So we're glad that we are aware of it. Yeah, the question is, what are we doing about our deputies that were exposed? I think we have at least 6 of our first responders. That would include our animal control personnel that went into the home where the couple unfortunately died, and they had to do something with their dogs. They're safe. They're safe right now, and so they're under our care of our health provider. We actually have a clinic that works with the sheriff's office. She's aware of all of their exposure. They'll all have an opportunity to take whatever medications that could be available. And of course, now that they know, they'll be careful to watch for flu-like symptoms or any other symptoms that might occur. Yeah, your question is how many occurred last year, and I don't know the answer. I'm sure it can be answered up here. Our sheriff's office did not know Thursday. We had not disseminated any information to our troops. They were responding to calls like this without being aware that we were a hotspot, unless, of course, they had read it in some media report somewhere. I hadn't seen it. I became aware of the hepatitis problem here in Martin County, hepatitis A, Thursday, yesterday, when our medical examiner told us that his findings on the autopsy led him to believe that that both deaths occurred because of complications arriving from hepatitis A. What was my reaction? Well, first of all, I was very saddened. I peripherally knew one of the victims of that case. I was alarmed that people that were not in the target group, we keep talking about my jail, we talk about homeless. Neither one of these people fit that. So these were your everyday person, and we don't know how they got it. So we've offered the full services of the Martin County Sheriff's Office to help backtrack it. If the State Department gets on a lead, we'll be glad to help. But we now know, and so we'll be extremely cautious. We get what we call locate and notifies or check on the welfare cases all the time. This actually was one of those where coworkers or a family member, I think, called us and said, "Hey, would you go check on them? They don't sound right." And we went to the house, so we had one bite at the apple of being exposed to it ourselves, and they said they were going to take their medical care in their own hands. We left. The next day, we went back and they were dead. So then we again were exposed to whatever could have been in that neither time, knowing that there was hepatitis A. Yeah, the question, of course, you're asking a cop, not a doctor, or the health department, was what should our takeaway be that people outside the risk group got hepatitis A? My takeaway is this: I plan to get vaccinated myself. Of course, you could say I'm in the high risk group, although much of my day is spent here safely in my office. I do go out on the streets. I'm actually dressed in myself response clothing today, anticipating going out. So I'm going to go ahead and get the shot. And I think anybody who eats out, eats at salad bars, eats sushi, does anything, you can wash your hands all day long, but if it's on your salad, that's not going to help you a whole lot. I'm just thinking, I'm a cop. I'm a first responder. If you're bleeding on the side of the road, I can help you. But I can't do much about epidemiology. But that's my answer you asked me. Yes, we're going to move. We're going to do something with our jail population. They are clearly a high risk. Because people in the jail live a lifestyle, unfortunately, that fits the criteria. They can be IV drug users, not all of them. They can be in situations, in homeless situations, where there's clear indication that that's a high risk. Then they come to our jail, and they may bring it with them.
The question was, beyond just the high risk population, what about everyone else? I happen to be the chairman of the board currently, but I'm also the District 5 commissioner, which is Palm City, and I'm a Palm City resident and a Palm City parent. So I just wanted to reassure not just the members of the residents of Martin County, but specifically the folks that live in Palm City, where tragically Mr. and Mrs. Kirsch lived and passed away. So first thing I want to say while we have all of this technical talk is that our hearts go out to the Kirsch family. This is a very personal issue where two members of our community have lost their lives, and it's sort of been the rally cry. I think that what we've heard so far, hand washing, we've always heard about hand washing, but I think the vaccine is a smart choice. There is really no downside to having the vaccine, and then it does, after the two, sort of vaccinate you for life. So considering that there's really no downside, why wouldn't we consider that as a safety precaution? The folks in Palm City, I'm sure, are alarmed. A couple of the cases out of the 13 confirmed, obviously 2 fatalities and at least 1 other confirmed, is in Palm City. My personal direction to our staff is to see if there are some patterns. That's a logical question. If they all seem to be happening in a relatively isolated area, then we really need to dig in and find out what that might be. The other issue is children mostly have been vaccinated already, but we're all familiar with that there is a subset of the population that do not vaccinate their children, so they would have to take that into consideration. I think when, we all heard what happened to the couple, they were relatively healthy prior to this, but they obviously had some symptoms that contributed to their passing. How I would reassure our public is twofold. One, we know that there is an option for protecting yourself from this, which is a vaccination. And 2, we have all of the resources from the sheriff's office, fire rescue, county employees, the health department. The conference call that we had this morning was a statewide call with organizations and doctors. I would also say that Cleveland Clinic, we have their representatives here. They are all part of this. We are prepared as a group for any type of emergency. This is a new one for us, but I feel comfortable that we will get to the bottom of it. You did hear that this is a statewide issue. It's also a national issue. But for us, when you have your friends and neighbors pass away, it elevates the concern. So I think that it's important. What we're doing right now is very important. We want to educate people without scaring them. So with that in mind, the question was earlier, how do you get this information out? Well, you're our partners in getting this information out. I think social media is remarkable, but there's still plenty of folks, and some of them could potentially be high risk, not drug users or homeless, but people that might have pre-existing medical conditions that exposure could really compound their issues. And that might be what happened to the couple in Palm City. But until we know that, there's a reason. I think reasonable people can be concerned. But between the vaccination and staying informed and not getting panicked, social media is helpful for educating. but it's also helpful for making people afraid. So I think the more information that we can disseminate, and we've already made a commitment, we all have, that when we hear things, you will hear about them very, very quickly and accurately. Thank you.
Actually, well, again, I can't speak to those specific cases. And again, there could be information within there that could answer some of these questions. But as far as our outreach efforts, when the trigger on this was 5 cases for high risk population, not mass vaccination of the entire public. So that is the message that I can share with you. Of course, hand wash for the general population. And if you feel vaccination is something that you desire, then you can do that. And it is available locally to you at the local pharmacies. And again, if you have underlying health conditions, should you be of concern? Certainly, if you are feeling ill, you need to go see your physician. They can properly diagnose you and lead you in the proper direction for proper health care. Self-diagnosing and reporting, on your own is not the proper way to do it. Proper hygiene and dealing with your physicians. That's how we control this. That's how we get through this. And I am confident we can with your help and your assistance on sharing that message. I think to answer your question, we're working that process. We're working that plan. It is not complete. That's part of dealing with this type of situation, working with our partners. So yes, all that information is unfolding in front of us today. My epidemiologist for this community was in this meeting. She's back at my office now doing her job, tracking illnesses. That's what we do. That's our job. That's what we'll continue to do, and we will continue to work with our partners and provide you with information that you can share with the public to where we can work through this. Those protocols are established by our state office. Again, we're not alone here at the local level. We do communicate frequently and rapidly with our toxicologists and physicians that are up there, and had conversations with them multiple times over the past several months on this topic, of course, and with our partners this morning. They were on the call with us, our toxicologists, our epidemiologists from Tallahassee. We're trying to work through this the best that we possibly can and not put out a message that's not going to create fear in our community. There's a way to handle this, and that's what we're doing. Well, again, we just hit the 5 cases, and Renee, correct me if I'm wrong, but how many cases are there? So depending on the population, so we can provide you that information is available on our website. And it's not uncommon. It's just, like I said, it's like other viruses and diseases that work through our community. So, how we handle it and how we deal with it, this is part of the process. On a daily basis, there's multiple reportable diseases that are required to be reported to the health department for tracking purposes. All physicians are informed of that. Our local physicians have even been heightened and made aware of this current scenario. So yes, we work through those procedures and try to ensure that we're capturing accurate data, not, like I said before, self-reported. If you're ill, you need to see your physician, and that's the way it needs to be reported through, not self-diagnosing. Possibly, because it may take several tests and several assays to go through before we can confirm it. So again, I don't report individual cases. We report, if we were having a series of number of cases where we need to get involved and try and determine what is the cause of this and what is the source. It's not my decision, this is a decision that's formulated through our Department of Health, through many people, not just my own. So we follow protocol and procedures just like everybody does to try and provide effective messaging and effective response. So decisions have to be made on that in many avenues, including, not to overhype something and also to make sure the message is effective. I'd prefer the first responders respond to that because they deal with these type of illnesses on a daily basis. As soon as we're able to notify them and get them engaged, we do. We were still confirming cases that were being reported as confirmed, which were not. You'd have to repeat that question. I feel like the line of questioning.
We understand where we are right now.
This is Renee Rouse. She's our public information officer.
And I just think you have to understand where we are right now. And where we are right now is we're standing united with our partners. We're engaging. We're talking about our plans. We're working together to reassure the community. That's where we are now. That's where we need your support to inform the public about currently what's happening and what they can do to protect themselves. That is the most important message here. And I think that we've covered for the majority of your questions quite in depth, and we will be reporting back later today.
Megan, just a,
sort of talking in the past right now, meaning we're still running through confirmation and following our protocol before we reach out to anyone. We have to confirm things. So I need to get to you if you want specific dates. We have timelines on everything. We can provide that to you. I have no problem with that.
just one thing to clarify, communicable diseases, there's a vast array of. And to give you an idea, the Florida Department of Health is not the only agency that might reach out to us as first responders. The hospitals work with us hand in hand. Meningitis is another contagious disease. Megan, you were talking about some of the others. But they might report to us that they are symptomology that's consistent with meningitis, but they might have to confirm it through a test that takes 3 days. So some of these things, again, there's a process in place. And so we're not as quick. I mean, as soon as we are aware of it, we can react and inform. But it's confirming before and the sheriff said it very well, or Commissioner Campy, we don't want to alert the public and use fear, because eventually, if we keep doing this, you're not going to take or give us any credit with what we have to say. If we're giving you information that might concern the public, and we find out 2 days later that, it was false information. So we take it very seriously that we give accurate information that we portray to the public. Does that make sense? All right. Right.
Yes. They're absolutely good.
Right. Okay.
Actually, we're recommending that you obviously go to your primary care physician or a walk-in, or again, like CVS, pharmacies. But certainly, if you have concerns or issues, contact us. We'll work with you. We'll help you through that situation.
All right.
Thank you.
That concludes the press conference. Thank you.